Good evening. I'm Deb Van Walsum, President of the Auxiliary of Emerson Hospital. Thank you for attending this evening's panel discussion, Connected Youth, Loneliness in Children and Adolescents, the Importance of Connection and Belonging for Healthy Bodies and Minds. This is the second installment of the Connect Effect series, a collaboration between the Auxiliary and Corporators of Emerson Hospital. Both the Auxiliary and Corporators strive to bring education and awareness to important topics and resources available at Emerson Hospital and in our community. When we started planning this evening's event many months ago, we knew the topic was important. Since then, it has become even more so. We're fortunate to have an esteemed panel to share their insights, expertise, and resources with you. Before I introduce our panel, there's a few logistics about this evening. Tonight's discussion will be a webinar format, meaning that the guests will have both video and audio turned off to allow maximum screen space for our presenters and their visuals. As time allows, we will field additional questions at the end of the presentation. Please type your question using the Q&A function on your screen. It's at the bottom. If applicable, please indicate to whom you would like to direct your question. Thanks. And now to introduce our panel. Amy Forer. Dr. Forer has 15 years of experience maintaining double boards in both internal medicine and pediatrics. She's a family practitioner at Emerson Family Medicine in Maynard. Dr. Forer is also an MGH physician caring for all ages in the MGH Chelsea Urgent Care. She is a graduate of the Loyola University Chicago Stritz School of Medicine. She has clinical interest in pediatric medicine and lifestyle modifications to improve patient health. Breton Mulder. Dr. Mulder serves as Director of Teen and Adult Services at Aspire and a clinical instructor at Harvard Medical School. He's a clinical psychologist with experience directing programs and working with teens and adults on the autism spectrum. He also sees children, teens, and adults for individual psychotherapy at the Laurie Center at MGH. He provides consultation to school systems and conducts training and workshops throughout the year for employers, clinicians, and educators. Ellie. Ellie is a student who will begin her freshman year of high school at a public high school this fall. She enjoys swimming, skiing, politics, and government. She lives in the Middlesex area with her family. Laurie Hunter. Dr. Hunter is the superintendent of the Concord and Concord-Carlisle Regional School Districts, where she has embraced a philosophy of continual growth and improvement. She has more than 30 years of experience in education as a teacher and administrator. Jennifer Hill, who is also our moderator for this evening, has a Master's of Science in Nursing and is a registered nurse board certified in emergency nursing. She serves as the Director of Emergency Services Nursing at Emerson Hospital and oversees the critical and dynamic function of more than 100 staff. She served 8 years in the United States Air Force. She has spent the last 20 years caring for patients in New Hampshire in progressive leadership roles prior to coming to Emerson Hospital last fall. Thank you all for joining us, and I'll turn it over to Jennifer.
Good evening. I'd like to welcome everybody. We'll be going through a series of questions to start. I'll start by asking each panelist kind of have that discussion to begin with, and then we'll go from there, review some questions that the listeners may have. So our first panel discussion is regarding what are some of the warning signs of loneliness in adolescence. And to start that discussion, I'm going to ask Ellie if you can speak to that.
Sure, and welcome everyone, and thank you for joining. So I would say some of the warning signs of loneliness in children and teenagers specifically is that the child has trouble connecting with their peers. They seem distant or even distracted, and they just spend a lot of time alone. They like to do things with themselves more than other people. And they just seem to kind of do their own thing and not really connect with their peers.
Dr. Forer, I'm going to turn that over to you now. Same question, please.
Okay, thank you to everyone for joining us, and thanks, Ellie, for getting us started on the first question. So I think it's important just to start by saying, well, what is loneliness? So how are we defining it? And the way loneliness is defined is actually more subjective. It's a state of mind. It's the feeling of being alone and the feeling of not being able to share things with other people. So you can imagine that someone can physically be surrounded by people and still feel alone, while other people can actually be isolated and also be alone. So it's a subjective feeling of just loneliness. And like Ellie mentioned, different ages of children can present in different ways. So our younger children may make up imaginary friends. They may ask parents to play with them more. They may act out. Our teenagers, they may spend more time behind closed doors. They also may counterintuitively talk to us more. And you may feel as a parent that shift, and that may be a sign that your child is feeling lonely. They also may tell you that they're not connecting with their peers or they have nothing in common with them. And another thing they may do is just talk negatively about themselves. They may start to feel sad and talk down about themselves. One of the more worrisome signs of loneliness is if you feel as though your child is also becoming hopeless. So hopelessness is a more ominous sign, and that's why when a child is starting to feel lonely, we want to understand that and kind of get them some social skills so that they can feel better about themselves.
Great, thank you very much. Dr. Hunter, would you share your perspective, please?
Sure. And, you know, I think from the school's vantage, we're often spotting symptoms of loneliness without exactly knowing what's going on. So it's worth noting what some of those symptoms are. I think you've named some of them, but we also watch for changes in performance in school, changes in engagement in school. Teachers who knew a child with some history, we watch for differences as that evolves. We've been talking a lot about mental health in the schools. Pre-COVID, we had already named a mental health crisis, and we're watching kids with really high levels of anxiety and depression and all that comes with the loneliness or results of the loneliness. And really trying to talk through that. We've had some really open conversations with the kids this winter, unfortunately following a suicide. And what I heard loud and clear from them was that the stigma of loneliness and all these other emotions needs to come down so that we can talk about it openly and kids understand that they're not the only one feeling some of these things. We know social media ironically adds to the loneliness because of the way it portrays kids' lives and the way they interpret what their life could or should be. And as much as we think it connects them, I think it isolates kids as well. And then so that's the feeling alone part. And then now we're into this incredibly odd physically alone part since we closed school in March, thankfully about to reopen, which I can talk more on that. And so much of our efforts to reopen is about these topics. That suddenly not only kids who were already feeling alone, but we had, you know, gross numbers of kids physically alone, and what that contributed to what we already thought was a mental health crisis. So, and now trying to really reconnect everybody back together in physical ways that we had been working through virtually. So I can talk more on any of those topics, but that'll be my answer for now.
Thank you. Dr. Mulder, can you share with us?
Yeah, I just wanted to start by saying feel very honored and privileged to be part of this panel. I think this is such an important topic. And I wanted to echo Dr. Forrest's comment. Ellie, thank you for heading us off. I don't think I had the composure at your age to be here in a panel talking to all these people virtually. So admire the courage that you have to be starting us off and to be part of this conversation with us. I wanted to add to one thing that Dr. Ford said at the beginning about sort of helping us to understand this feeling of loneliness, that I think loneliness is often, as Dr. Ford was saying, this feeling that we have, a negative subjective feeling about the quality of our relationships, how we perceive our relationships. And I think to some degree, some of the research has looked at that when we're feeling lonely, when we have this subjective feeling, we're seeing our relationships as not being satisfying in some ways, like either in terms of their quality or their quantity. And said another way, it may be that we don't have enough relationships, or that our relationships, we want to have better relationships with others. And I think that subjective feeling of loneliness is different from aloneness, the sense that we're like physically alone, we're not in other people's company. Because about aloneness, we can have a more or less positive or negative attitude. That some of us can be really content being alone, or we can be really feel discontent being alone. And I think loneliness is often categorized and labeled as this really negative feeling, this kind of dysphoric, uncomfortable feeling about how we perceive our relationships. And so I think in thinking about loneliness, at times when we have it, when we feel it, it can signal something in us that we should reach out more, we should try to develop more connections. And most of us at times have probably felt lonely in the context of this ongoing pandemic, where we're doing things virtually and remotely. And so it can be motivating to some degree. But what I really like about this question is that there also can be some warning signs that we've all been talking about, that the way in which we're making sense of these feelings of loneliness can be potentially heading us off and just heading us into some troubling areas. Dr. Ford mentioned kind of hopelessness being one of those. So if you could sort of get into the mind of someone feeling lonely and trying to make sense of that, could be wondering, why is it that I am lonely? Why is it that I have less friends than I want? Why is it that my relationships are not as satisfying as I want? And if the person could very easily get to a place of, well, maybe there's something wrong with me. Maybe other people don't like me. Maybe I don't have desirable qualities. Maybe I'm not a person that other people want to be friends with. So it can very quickly get to this place of impacting a person's self-esteem in a really negative way. It can create heightened sensitivity, fear of social threats, avoidance of social interactions, and all those things can kind of create more isolation for the person, and kind of be somewhat self-fulfilling. And I think the point that Dr. Ford made about hopelessness is really important to notice, that if you're hearing these things from someone about like, it's just never going to change, I'm never going to develop relationships with someone, that's a really troubling sign. That I think the point that Dr. Hunter made about not stigmatizing these feelings is really important, and noticing sort of when is it a time and a space to for someone to kind of get some support and help for what they might be going through.
Thank you. You've all done an excellent job describing your perspective on those warning signs and helping us to identify it. But the next step is that we see those warning signs, and then what do we do about it? So how do we talk about, identifying the loneliness, and how do you speak to your child, your healthcare worker, your school, and be able to articulate the signs that you're seeing, and then assist your child in getting that help. So Dr. Forer, how would you recommend that someone go about doing that?
Yeah, this is a really good question, and I like it a lot, because it's really about how do you just start going in the right direction. So the first thing, I can address this as how do we talk to our children, and then how do we talk to our healthcare provider. So the first thing is to start the conversation. As hard it is as a parent, it's so important that you understand that just by talking about mental health conditions, loneliness, depression, anxiety, suicidality, you're not creating that problem for your child, nor are you exacerbating it. What you're doing to your child in that moment is you're communicating that you know, as the parent, that these state of minds exist, and that you know that they're there. And so your child will remember this and potentially come back to you in the future if they're not ready to talk about it right away. So it's sort of similar to what other people have said. We want to normalize loneliness. We want our child to know that many people in their lives at some point in time do experience loneliness. And maybe you can even share a time in your life where you felt alone and unsupported, and that you weren't able to share something that you were going through with friends. So it destigmatizes it and makes it so much easier for your child to talk with you about it. The other thing about talking to your child is you might not want to say, oh, are you lonely? You may want to use other phrases like, would you enjoy company? Or do you feel understood by your friends? Other phrases that may be helpful is just tell me what interests or hobbies you share with your friends. Sort of just gets the conversation going. And as a healthcare provider, I want to know if you're worried about something. So if you as a parent are trying to untangle, is my child lonely or introverted? Why have I experienced this shift in my child's interactions with their peers over the last couple of months? What's really going on? If you as a parent have concerns, even if it's minor, don't hesitate to bring it to the healthcare provider, because at well checks or even sick visits, I screen for mental health conditions such as anxiety and depression. But if a parent brings it to my attention, I'm going to probably spend more time trying to really untangle something that may be there, as opposed to just screening it. And then I can help the family get back on track and figure out what resources we can use to help them do that.
Thank you. And I guess one of the questions that we may pose back is that the parent wants to be able to express something to the healthcare provider, but sometimes they're not comfortable doing that. You know what I mean? Especially with the adolescent, it's that fine line of them being able to articulate things for themselves and then the parent giving that input. So is there a recommendation that you have for that parent that may be uncomfortable speaking in front of healthcare provider?
That's a good question. I can talk to parents alone and I can talk to children alone. So it goes both ways. So for example, a parent may call me a day before the appointment, say, so-and-so's coming in tomorrow for their 15 well child check. This is what I've noticed. Just to put it out there. And then when children are usually 13 and older, I spend time with them by myself with parental permission. And we talk about these types of things. I ask them about anxiety, depression, substance abuse, and self-harm. And so we spend time talking about those things. And then also, if the family's not able to talk about it, so if you as a parent are just like, I can't do it, or if the child wants to communicate something back to the parent, I can help with those conversations and we can have those in the office.
Excellent. Thank you very much. Dr. Mulder, can you give us your perspective?
Yeah, I wanted to emphasize one of the points that Dr. Four made about, I think, the importance of normalizing these feelings. I think particularly for adolescents, that I think it's important to normalize the feelings for all of us that could be experiencing this. But I think if we normalize them also within a developmental frame, that teenagers in a sense have a heightened capacity to be feeling lonely, because I think what's happened developmentally in the teenage years is the importance of relationships are developmentally becoming more and more prominent in the person's awareness, that they're defining themselves more in the context of relationships, and they're putting higher expectations on relationships. They're getting all sorts of peer support. And so I think there's no wonder that teenagers at times are feeling like, oh, my relationships aren't as satisfying as I might want them to be, or I want more relationships. I want higher quality of relationships. So I think teenagers of all stripes and sizes are going to be feeling lonely at different times. And I think that point of normalizing those feelings of aloneness is really, really important. I'd emphasize two other things that I think are relevant in talking to a child, him, her, themselves, to a clinician, and also to the school. I'd add that if we practice a stance of acceptance, of curiosity, of non-judgment, and self-compassion about these feelings of aloneness, I think that's really important. I'll kind of explain that in a moment. And I think also if we support ways for teens to connect and develop different kinds of relationships when we're talking to children and talking to clinicians and talking to schools, I think that's important. So about that first point about kind of our stance of how we talk about feelings and regard feelings, I think if we're accepting of these feelings, like the point Dr. Four made, that we're normalizing them and we're accepting them, that loneliness is labeled as a negative feeling, but if we're accepting this as just something that we feel, And if we bring kind of some curiosity to it, like, okay, I'm feeling this feeling of loneliness, but why is this happening? Well, we're in the midst of a pandemic. No one is actually connecting with each other in various ways. But bring some curiosity as to why that might be going on instead of judgment. And also bring some self-compassion. I think one of the things psychologically that can very much make our feelings supercharged into having negative effects is if when we feel shame about the feeling that we're having. That can be we can feel shame about loneliness. And so if we take away this tendency to sort of judge ourselves for having these feelings, I think is really important. And so practicing that kind of stance toward the feeling of loneliness, I think it can be really helpful. And I think also concretely supporting ways for teenagers to connect and develop different kinds of relationships that many teens and adults, we connect around areas of shared interest. And so schools can have a critical role in this, where they can help facilitate different kinds of groups and clubs that might be happening. You know, it could be anything from a Dungeons and Dragons group to a video game group, anime. Could be based around more person's identity, like a pride group or a neurodiversity group. But these schools can have a critical role in helping teens to connect and to connect around these areas of shared interest that can have an effect on both the quality and the quantity of a person's relationships and affect these feelings of aloneness. But then also helping teenagers to support different kinds of relationships. They have relationships with peers, their relationships with their parents and caregivers, but then also there's all these other important relationships they can develop with coaches and mentors and tutors and individuals within a religious community, family members. By diversifying kind of the different relationships that a person has, I think can also affect these feelings of loneliness. So I think that there's a role there that the school can play, that the clinician can facilitate, and that can help support the teen or the child too.
Looks like I'm unmuted now. Sorry, I was muted there for a moment. Dr. Hunter, how would you recommend a child or a parent going about communicating the loneliness with the school?
Yeah, I think similar responses actually to I think what the doctors have said. And this is really hard for some families. We want to be partners with you, and we need to be partners with you. And sometimes that's a really hard initial approach to us. We recognize that, but we also want to be sure everyone knows that it's just really, really important. And there's all different ways to do that. At the high school, every student has a guidance counselor. That person should be someone you feel you can call at any point and really engage with them on what's going on with your child. And that can be that. Ellie, cover yours. Your child doesn't have to know that we've had that phone call, but we can be working magic to try to make sure we're supporting and structuring and watching for things. And teachers are going to be able to facilitate different ways with collaborative work and foster things. And we just can be so much more able to be effective if we know that there's a concern. On the flip side of that, sometimes we're the ones voicing the concern. And that's a partnership that we sometimes have to, tread carefully into and try to open a dialogue to say, we are worried, and here are some signs that we see. And I think so much of this is about stigma and trying to be sure that we're all safe with each other to say, it's okay that your child feels this way. It's not your fault. It's not their fault. We're all here to work together and to talk through what needs to be done. And, we get the gift. At least I feel like we can be very actionable in a way that makes us feel like we can actually help a family, move some things, I think is really what you're referencing with clubs and activities and sports. And school is so much deeper than just the academics that can connect kids with each other. And that's very empowering for us, because sometimes there's ways we can find that one place a child can connect, or that one trusted adult. We work really hard to be sure kids have that one trusted adult they would reach out to. And then I think the final piece, sometimes it's peers of kids that will tell us what's going on. And sometimes that's our avenue to know more. And sometimes that's the way And I just want to be sure we don't miss the power of a peer who's watching another peer struggle. One peer may be feeling really lonely, and indeed their friends are actually really pretty concerned. And that more often than not may be how we get engaged in supporting. And we will pick up the phone and call that parent and say, you know, someone, your child's friend just reported some things that were said or done, or changes in behavior. And you know, I guess we get to be a spoke to some extent, and we just want to be sure that is being maximized. And it can be hard at first. We totally appreciate that, but we're all really committed to working for kids and making sure we're changing things where we need to. And pretty high on our priority list right now, if not the priority.
And would you say if a child, for example, who has 7, 8 teachers at a school or a coach, you have all these partners to support the child, if they had one person that they felt more comfortable with, that one person would more than likely contact that guidance counselor, and then you'd work as a team?
Absolutely. So if a child has, and of course there's varying relationships among that many adults, but we work really hard to be sure that kids do have someone they feel connected to. And that adult then will share with a guidance counselor to a parent. Often that's the way we structure things, to make sure all the information is channeled. So really important. And I think important for parents to just talk with kids about, who is that adult you might talk to at school? Because we can be a little bit of the safety net. If they're not talking to you as mom and dad, which I have an 18 and 20-year-old, I completely appreciate that. Sometimes they will share someone else, and we want to be sure that communication vehicle is available.
Thank you, Dr. Hunter. Ellie, how would you go about speaking to somebody? What's your perspective? Would you be comfortable approaching, your peer or your physician, or somebody at school that you'd feel comfortable with?
Sure, yeah. So I think the number one suggestion is try not to force the conversation so it becomes awkward or uncomfortable for your child. I think that will do more harm than good at some point down the road. I really liked what Dr. Forrest said about kind of rephrasing the question, are you lonely? I think that's a really good start, and I think that's a really good way of kind of introducing the topic. I would also suggest doing it in a way that is best for your child. So whether that be coming home from a soccer practice or at the dinner table or sometime when you have a quiet moment, I would suggest just doing it in a way that's best for your child. I would also say try not to keep things from your child. Be open and honest. You don't have to say all the information at once. Just be open and honest. Yeah. And from a clinician and school perspective, I would say make sure that the child has a good relationship with, and vice versa. So make sure that the clinician or whoever the contact is at the school has a relationship, and vice versa. Yeah.
So don't blanket that question of what happened at school today and leave it at that.
Yeah.
Really deep dive, yeah. So we kind of touched on this before, but technology really impacts our society today, and even more so, like this Zoom conversation, now that we've had all these precautions because of the pandemic. So what might be some of these effects of the technology, both the loneliness as well as discovering connections, because we're connecting obviously in a different way. We lack a lot of that physical touch. We're missing those handshakes. We're missing those hugs that we might have expressed with others. And so how would you give us some advice on how to deal with some of those effects? So Dr. Hunter, I'll put you on the panel first this time.
Sure, thank you. We've talked a lot with students over the course of the school closure and through the summer, and loud and clear, the priority was their need to get back to school for all the reasons I think we just spoke about. I think it's a really interesting time where I think we've been pushing against the technology in a lot of ways, because the one thing we know in the schools is there's this whole world now that exists in the social media that we don't have access to. And we don't know what those messages are between kids, usually until they're a problem and they bubble up to us. And we feel like we're just not available to that unless it's shared with us in a way that can be really hard. And yet right now we went from, a mission of trying to minimize screen time to now that being our entire way of operating and the only way we're connected through the last 6 months. So we've been really differentiating and tweaking the message about it's the use of the technology that's the thing to watch, not the technology itself. Admittedly, a message we changed kind of on the fly as all this played out. But, I've said to so many people as we've started to re-enter and get ready for the kids, imagine what this school closure would have been without a Zoom and all these tools that we have, and it would have been catastrophic. So that was a positive, right? But the way that we know the technology can have impact can be such a negative in the way we lose, kids lose hours to it, and they're in social media and they're seeing kids who look perfect, who aren't, but that's all they see is the perfection. So really trying to help parents, and we've been running, actually this week we're running other nights about, parental support as we did through the closure and into the, this hybrid thing we're going to start in the next week of kids are still on these devices half the time. It's about the use of the technology and what purpose it's serving, not just the screen time itself. So that's a new message for us and one that's evolved. And I think it's an important one as we're in this very unusual place.
Thank you, Dr. Hunter. Dr. Mulder, how would you say technology is impacting the effects of loneliness?
Yeah, I think this is such an interesting question. And, we were talking about how loneliness can result for anyone when there's this desire for relationships to be better in some way or to have more relationships. And I think this question gets at how technology could be potentially negative, but then the point that Dr. Hunter made, how it can be really utilized, I think, in a powerful way as a tool. I think on the one hand, potentially on the negative side, social media has this tendency to heighten our perception that others are having much more satisfying relationships than us. You see these posts on Facebook or Instagram or all these places, and everyone looks to be having a great day at certain times. And I think that can heighten the perception that, oh, their relationships are better than mine. And so I think that's one component. Social media also, with the way things like Facebook is structured, you can concretely count how many friends someone has on Facebook or other forms of social media. So I think that can heighten that other aspect of loneliness where you can say, well, that person has 425 friends and I have 25 on Facebook. What's that about? So I think it can at times, with the way just the platforms are structured, can heighten these feelings of aloneness or of loneliness. But I think there's another aspect to technology that's really powerful. Dr. Hunter made the point that how on earth would we be dealing with all of this during a pandemic if we didn't have these different forms of technology? I have a team that I worked with for a while who he had a special interest in aviation and in planes, and he knew an extraordinary amount about planes. And one of the things he loved to do is he would go outside and he would plane spot, kind of analogous to bird watching, and he could identify a plane thousands of feet in the air, knew what model it was, knew what kind of plane it was, which carrier, and he loved to do this. It was something that brought him so much joy and pleasure. And there was not anyone else at his school who had this similar kind of interest. But he got online, he got a YouTube channel, and he would post about some of these things. And he met someone in North Carolina, met someone in Texas, met someone out in Washington, and they all had the same interests. And they started connecting with each other and talking about planes. And then as months went by, they figured out ways to travel to each other and hang out. And it was because of technology that they were able to develop these more satisfying connections with each other. So I think technology has these dual aspects where it can really heighten some of these feelings and make us feel more alone, but it can be harnessed in a way, I think, to help us to connect with each other and develop more meaningful connections too.
Great points. Thank you, Dr. Hunter and Dr. Mulder. Dr. Foer, I would turn it to you now. How do you see technology impacting where we are right now?
Sure. Well, nothing beats those peer-to-peer interactions. And that's why we're working so hard. Like Dr. Hunter has been spending endless nights and weekends working so hard to get our kids back into the school. So thank you very much. because it's about education, but it's also about how they develop. And so those peer-to-peer interactions, they learn so much from a young age. Like our preschoolers, they learn how to regulate their emotions. They know how to cooperate. And our elementary school age children start to learn about winning and losing. And how to see somebody else's perspective of a problem. Our teenagers are learning a ton. They're learning about intimacy. They're learning about boundaries. They're learning about how to give and receive support from a peer. So nothing really beats those in-person interactions. And so what's kind of evolved is this imperfect solution, which is technology, especially during the time of the pandemic. And I would say with respect to loneliness, it's very similar to what Dr. Mulder said. It's really for better or for worse, you know. For better, yes, children are finding support online. They're finding support when they're facing challenges. They are developing friends. There are some research that shows that if a kid already knows somebody and then games with them online, that relationship can be strengthened. But really with loneliness, it really is for worse. You know, there's a lot more problems with online social media, such as bullying or rumor spreading. And exactly what Dr. Mulder said, there's this shift in what we define as friendships. So we have shifted from understanding friendships as a quantity, a number, a measurement, as opposed to a quality. So what is a good friend, and how does that friend make you feel? And a lot of people right now are missing that intimate relationship, that in-person interaction, for which humans really gain so much.
Thank you very much. Ellie, can you talk to us a little bit about technology and maybe how you use it and you've made those connections, or what you find challenging about using technology?
Yeah, so especially focusing in on social media, it can be kind of toxic in a way. It's essentially, it's getting likes for stuff you post, which should, in my opinion, never be a thing. Like, you don't need likes. Likes do not value you at all in any way. Like, I just think that's kind of like the toxic part of social media, but there definitely are a lot of ways to make connections online. Especially in the middle of a pandemic. You can FaceTime, you can text, you can Zoom, there's online games you can play. And especially resources like Facebook groups, which I found really helpful, especially starting a new school remotely. There's groups for clubs, there's groups for things you're interested in. I think it was Dr. Mulder who brought up the YouTube channel about the airplane. There's ways to share your interests with other people, to connect with others who have those interests, which is really great and really fantastic.
Thank you. I can definitely say from having 3 daughters and my oldest into college now, she knew more about her roommate 4 weeks before she started than I did 2 months into my college education. So that's definitely something that's benefited, I think, children. So what are some ways that we can help teens find and develop more of a connection during these times, with still obeying by the social distancing and the rules of today? Dr. Mulder, can you start us off with that one?
Muted. Sorry, looking a bit at sort of what can we do now, or did you want us to speak to that, or to speak to sort of what are some of the barriers?
We can definitely look at both. I mean, you know, whatever perspective you want to give us, but either the barriers or ways that we can actually to help to, you know, find connections during these times, either one. Yeah.
It's such a great question. I think some of the barriers, if we break them down, can be potentially neurological. So I work primarily with individuals on the autism spectrum. So an individual could have a neurological difference, possibly diagnosed on the autism spectrum, where it's making it hard for that person to pick up social cues, to read nonverbal communication. And that could be a barrier that's impacting that person's some of those skills with developing more satisfying relationships or developing more relationships. But in addition to neurological barriers, I think there can be psychological barriers too. There can be periods of heightened social anxiety that the person might be going through, which might be creating a lot of interference with the person connecting. They could be experiencing an underlying mood disorder, such as major depression, which could be depleting their motivation, which could be creating a significant barrier. If the person has gone through different kinds of trauma, it could have lasting effects on the self, where the person could have developed very negative self-beliefs. And that could certainly be creating a barrier for the person to be developing more connection. I think another category that could be creating a barrier could be sort of the person's identity as it's evolving over time. The person may be exploring their gender identity, their sexual orientation, and it's not uncommon for individuals to feel very lonely in that process and alone in that process, and to not know that others are also kind of having similar kind of thoughts or questions about their identity. And then I think there can be potentially societal barriers. There could be ongoing systemic racial and gender discrimination that the person could be experiencing that could be creating barriers for them. And so I think some of the things that can really help develop more connection are, all these things that we're talking about. But for many of us, sort of developing connection around these shared interests, helping to see commonality in another person, to just have the simple pleasure of experiencing joy of in those moments of connection and doing some activity together. And so I think our communities, our families, our schools, we all, providers, all of us kind of have a potential role to play in helping to support that.
Thank you, Dr. Mulder. Ellie, what would you say are either some challenges or ways that you would recommend that a teen might be able to develop connections?
Yeah, so I think just the number one thing is that people change, people find different interests, and especially around the teenage years, that can be really hard. But definitely some ways to kind of combat those barriers, especially given the current circumstances. There are ways to have fun and to be with people during a pandemic. I would suggest having a socially distant movie night in the backyard might be good, and everyone watches a movie and sits 6 feet apart, going for a walk, doing a Netflix party even. Yeah, there are ways to kind of stay safe and stay connected. I know some schools are doing meetups with teachers and students, which I think is really great. And even some clubs are taking place virtually. So I think that's also a great way to meet people and to hang out with people.
Thank you, Ellie. And Dr. Hunter, you're in a particular situation now where, you're looking at opening school, in different format. And what are some of the barriers that, you foresee going into this new school year that you could share with us?
Yeah, that was pretty long. We're making our way through them all, though, trying to maintain all of the critically important safety measures while we don't lose sight of the personal connection and relationships, which is the whole point of why we want to get back to the schools. So there's been a lot of creativity, a lot of adjusting to the new normal. I've been out walking the schools this week as the teachers have been back and we're setting things up. And some of it's just reacclimating yourself, like to what we were used to. The way the high school might be set up with some really comfortable, socially focused spots. They're not so comfortable today because we can't have them that way, but that doesn't mean the kids aren't going to be together. They're going to be spread out, and then now it's a single desk instead of a few nice cushy chairs, but that doesn't mean the togetherness is gone. I think just making sure we see those opportunities for where they are, as different as they might be. We're trying pretty desperately to hold on to any traditions and pieces, even if we've got to reinvent them. So like tomorrow and Thursday, we're bringing the freshmen in for their orientation. It's not going to look the same, and there's a lot of structure that normally would be a lot more relaxed, but we are bringing them to the campus and making our way through that. And I think that's just been the mindset, how can we do this? If we have to do it differently, that's okay. But how can we still provide so many different opportunities to try to have kids engage with each other and in all these different aspects that, pique their interests, that connect them so that similar characteristics are able to find each other. which we know for so many kids is the lifeline through high school, and make sure that that's still available to them. So we're hopeful. Admittedly, it's all a bit of a work in progress, and we're trying things we've never done before. So we're going to have to continually monitor and revise, but we're really hopeful that, you know, I guess I'll say out loud, the key is that we all work together at this, and that our ability to stay open and be successful in a COVID environment is the choices kids make both in school and probably even more so outside of school. Ellie's list is really fantastic of how to do that, because that's going to be the key to our togetherness is the control of the virus for the next however many months or longer. So it's a community endeavor for sure. I guess my last thing is we will not take it for granted. That part I know for sure. And I think that matters greatly. And maybe we're going to, you know, slow down. Our kids have been overstressed for a long time because of the demands of their schedules. And I think we were losing track of the connections with each other along the way. And I don't think we're going to do that anymore. And maybe that there's a, you know, silver lining in the reset that we're getting here. So I'm really hopeful about that. If I'm looking for positives, that's my hope, is that the way we were operating before wasn't necessarily healthy. So thanks.
You brought up some great points. And the one thing that you kind of touched on, I think, is, you know, even speaking to the kids, is grieving that loss, because I think we all feel it the way it used to be, that it's no longer, and then accepting it together seems like an important aspect of this. Dr. Forer, can you comment on this now, please? Oh, Dr. Forer, your mute still on. Sorry.
Sorry, I start. What I was saying is I think everyone outlined really nicely what the barriers are, and some of them are things that we brought into the pandemic, and then it was the pandemic. So, you know, if you're trying to develop some connectivity, I guess the couple things I would say is just start small. So remind yourself just to start with the simple stuff. So you teach your child when they get on that school bus for that first day going to elementary school with their mask on, it's still important, okay, to say hello to that bus driver, you know, and that is a connection right there. And then remind them that they are okay to smile and say hello to someone even though they're wearing a mask. So we have this physical barrier now that is really taking apart 50% of our expression. And so building those connectivities, there's a physical barrier as well as a mental barrier. Like my younger children want to stay not 6 feet apart, but 10 feet apart. You know, they're kind of putting this all in their own perspective and in their own minds. So start simple and remind our children and demonstrate to our children that those small connections will start to build. And then your family and your child will feel more connected to their community. The other thing I would say is that, you know, we've never experienced a health emergency for this prolonged. So the people who are mentoring our children, who are teaching our children, the clinicians taking care of our children, we've never gone through this. So one of the things we can just say to our kids is acknowledge that, hey, we're figuring this out on our own. We're trying to figure out how to run a company. We're trying to figure out how to open our schools. We're all learning and trying to figure this out together. And we're very optimistic that we're going to be successful.
Thank you. So we're going to go to our last question now before we open to the Q&A. So I do ask, we're going to keep our answers to this one relatively short so we have some time, because we do have many great questions. So now we've identified, or we feel that our child is actually lonely. What do I do with that? So Dr. Forer, what would you say that the parent should do for that?
I would just say briefly, start the conversation. Don't suffer alone. Nothing really comes of that except for ongoing suffering. If you're worried about your child, don't feel as if you have to figure it out on your own. Because we do want to address loneliness, because loneliness that becomes chronic does lead to other mental health conditions, anxiety, depression, self-harm, substance abuse, and physical ailments such as chronic headaches and abdominal pain. So what I would just say is start the conversation, normalize it. Just by asking your child, you don't create mental health concerns, nor do you exacerbate them.
Thank you. Dr. Hunter, same question. What do we do with that child that feels lonely now? How do we help them?
Yeah, I think it's just piggybacking on those first comments. And I know for us, the big underlying question is the why, and trying to slowly, when the child is ready, better understand what is causing what. Because once we get to that, we can actually change things and change perceptions of things and change the mindset. But it's the why for us, that peeling that back, and that can take time and take a partnership with the family. And sometimes it's a puzzle piece to put together, because the child may not be ready to just name it or even be able to name it, and we have to all map it out and come up with it collaboratively. So partnership, and take the time to understand what's causing that feeling in a child.
Thank you, Dr. Hunter. Ellie, what would you say? What would be your recommendation?
I would also start small, just start with a conversation, and then going at the pace of what you and your child and the clinician or the school or whoever's involved, just take it at a pace that feels comfortable for everyone involved, and that'll be most beneficial in helping you and your child.
Thank you, Ellie. And Dr. Mulder?
Yeah, I would add that I think it's really critically important as parents, if you're thinking this about your child, to not ever worry alone. That it doesn't do much good to just circle around in our own heads, to be reaching out, to be talking to others about this. I think the advice to start the conversation, and also that Dr. Hunter mentioned about the why, is critically important. That loneliness may be related to the child's some tension in the child's relationship with the parents. It may be related to the relationship with their peers. It could be both. And so it could be something like individual therapy for the child and helping support that child might be what's indicated, or helping support the family system and how they're connecting with each other and communicating. We wouldn't know what the why is, but understanding the why is critically important. But never worry alone. Reach out, talk to others about if you notice these concerns, so that you can partner with others to help support your child.
Thank you, Dr. Mulder. So a burning question come up a few times for the Q&A. When does technology become a worry, and how do we limit it? Would anybody like to start on that question? Dr. Mulder?
Oh, I mean, I just unmuted myself. That's a hard question, because it feels loaded right now, right? So our children are on school and they're on technology, and then what do we do when we're making dinner? We're trying to occupy them, or they go to their room and close their door and they're using technology. So it's become very blurred. So instead of giving you a quantity, I would just say make sure that what they're doing on their screens are meaningful, so that their child is actually benefiting from either developing some knowledge, enhancing a relationship, or connecting with a friend that they already know and strengthening that friendship. So use technology very wisely now, because it is so prevalent. And then I also think that it's really important to take a break. Like take a break and designate a time for yourself and for your family where no one's on screens. It's really, really hard. But going into this school year, I think it's a really good thing that a family could develop and get everybody on board, parents and children alike, to take a holiday, either a whole Sunday where you're not using technology, or an evening a week, your choice, but designating that time and then build on it.
I would add, I think those are such fantastic suggestions. I think one of the quickest ways to precipitate challenging behavior with your teenager is you get worried about technology, and it's like, all right, I'm gonna implement some strict limits, and then you've got big fights that are happening in the house. But I love the suggestions about what is it that's meaningful that's taking place on the technology. What is it facilitating? Taking breaks from technology. We all need that. But I think to just get worried about it and to decide, all right, I'm going to change expectations and set really firm limits immediately without any justification is a really quick way to precipitate really challenging behaviors at home.
Thank you, Dr. Mulder. And I think, Dr. Ford, you said it very well when you said kind of emulate that behavior, right? The whole family do it at once. It's hard to tell your child to get off technology as you're sitting there texting and emailing yourself. So I love that thought. Ellie, there's a question specifically for you. Someone's asking how prevalent that you think loneliness is amongst your peers. Do you see that? Have you recognized it in others?
That's a really good question, and I honestly do not know the answer to that. Yeah, that's a really good question that I do not know the answer to. I think there definitely are ways to recognize loneliness in your friends. I think it was Superintendent Hunter who said that friends have been kind of recognizing that their friends are lonely. And I think that's really interesting. And I think that's great that friends are kind of making or looking out for each other. And I think that's really great.
All right. Another question we're going to put out there is, how do you give your child a sense of belonging when the world is virtual? How do you help them establish those connections? Dr. Hunter, we'll ask you to answer this one.
You know, we've watched a lot of kids really get creative in how they've done that, you know, really purposeful community work, connecting with the hospital, connecting with the nursing homes, making masks, making cards, you know, making their own way of connecting with it. And I think in some way feeling more powerful that they're making it better for someone else. Those are great traits to have at any time, but certainly while we're in crisis, I know that it's mattered greatly. And sometimes it's really quiet ways, and sometimes they're getting a lot of attention. But I think it's about, you know, sort of stepping back and figuring out what's going to work for you as a young person. And, you know, we've tried to really just foster ideas and ways. And I think from the school district vantage point, we've been pretty active all summer long in a way we normally aren't. And I, you know, watched, you know, among the crises of all of these, we've watched inequity and social justice crises, and our students of color's voices have never been louder than they are this summer, because there's been a safe place for them. And this virtual environment has just allowed them this forum that is actually going to matter greatly. So it is about finding what's important to you and finding the way for it to work in the new mode we're in, at least for the temporary time being. I definitely have watched some kids really make that an opportunity rather than a negative. So we will continue to try to foster that in them.
Thank you. To kind of spin off that, because you spoke about some things that we can help the children with, but there some other guests are asking, what can a child do to actually escape the loneliness? So I know we've given some, you know, recommendations already, making those connections, finding something of interest. Does anybody else have anything to add to that, of what we can do to assist?
I guess the one thing that I would add is don't forget the connectivity between children and their pets. So right now, when we were all in serious shutdown and we couldn't go outside, the pets really became a really important outlet for children. So they became the thing that they took care of, the thing that they could connect with. So if you really think your child is still suffering and not quite ready to interact with a peer, you can start with some pets, and it gives the child a really good sense of identity and connectivity to an animal.
Excellent, thank you. It's actually funny that you said that, because I've had several staff members that have actually obtained animals during this pandemic. So that really puts out a good. Oh, sorry, cut out again. Any last thoughts that anybody has before we wrap up this last minute of the discussion?
I love what Dr. Forrest said about the animals. I'm a big believer in that, and connecting with animals is always great.
Hello, am I on? Great.
Yeah, welcome.
Thank you so much. I want you to take a moment to wrap up by saying thank you so much to our panel for giving us your time. We know how valuable it is right now, and to our audience for attending our event. If you have any additional questions or concerns, you can email the auxiliary at emersonauxiliary@gmail.com. And be sure to look for additional events and resources on the Emerson Hospital website, which is www.emersonhospital.org. And also check your inbox, because our attendees will be receiving a list of resources for you to look over. Thank you so much for this evening, and we hope to see all of you soon at another event. Thank you.